Hey everybody, my name is Steve Ross, and I'm going to take my mask off as we all wear our masks to recognize the importance of wearing masks in the community. And I invite the panelists also to take their masks off at the time. Again, my name is Steve Ross. I'm the co-chair with Dr. Frank Shushock, Virginia Tech, of the Town Gown Committee. We meet monthly, 3 times in the fall semester, 2 times in the spring semester, and this is our final meeting of the year. So I'd like to welcome everybody to our final meeting of the year. It's a special meeting. It's a little different than our normal meeting. We're going to have a panel discussion with some very knowledgeable people in the community about what's happening with this pandemic. So let me introduce the panel right now. We have Mayor Leslie Hagersmith from the town of Blacksburg. We have Chief Anthony Wilson from the Blacksburg Police Department. We have Dr. Frank Shushock, my co-chair for Virginia Tech, the Vice President for Student Affairs. And we have Dr. Noel Bissell, who is the Director of the New River Health District. And let me turn it over to our facilitator, Don Jeffries.
Hi, good evening, everyone. Hi, Steve. Thank you for that. Welcome, everyone. Thank you for watching. I just wanted to say that tonight we are going to spend some time looking back, talking a little bit about some of the lessons learned as we've worked through the last several months in this pandemic. We'll share our gratitude, give our panelists an opportunity to do that, as well as focus on some of the things that we need to do moving forward, some of the things we need to think about as we head into spring, which seems so very far away, but we're going to talk about that as well because it's very important. With that, I'm going to get right to the questions. And Dr. Bissell, if I can talk with you first, can you just give us an update on where things stand in our community in terms of this pandemic?
So sure, Dawn, thanks so much. I sent you kind of our update that we send out to our task force. And just to give everyone a little bit of background, early on, a task force was formed to address the pandemic. And we've been at it for several months now. One of the things we realized that we needed to do was to update the community about what we're doing. And so we now update 3 times a week with kind of current numbers, kind of big happenings, and where things stand. So if you just look at the first one, it talks about the number of people who are in the hospital because we have to take stock of where our hospitalizations are. There's talk about anxiety and stress. Over 50 to 60% of people surveyed say that this is adversely affecting them as far as stress and anxiety go. Flu activity obviously is a new thing because we're into flu season. And then it just talks about different safety precautions, obviously wearing our mask, watching our distance, and washing our hands. If you go to the next slide, it gives kind of a graphic of where we are with the numbers in the New River Health District, and it breaks things down by demographics, by gender, and by each of our localities. The next slides will show our Epi Curves, and these are our epidemic curves of what's actually happening in our community. And this goes from the beginning of August to November. We really did not see a significant amount of activity early in the summer. We obviously, when things really started in the spring, we were making our preparations, but as most communicable diseases, it took some time to hit Southwest Virginia. This one kind of follows that same trend, kind of comes down the I-81 corridor. So we were a little bit delayed, but you can see early on in August, early September, we did have a spike, and that did coincide with our university students returning. And now if you look at late October into November, you'll see that we have kind of a second little bump there, and that relates to more community spread. If we break it down, the next curve goes to Montgomery County. You can see again early on that elevation in the curve is from our students and the bump we saw. And then it kind of came back down to a plateau and has remained relatively stable. The far right is just that we haven't caught up. It didn't drop off precipitously. We expect that it's kind of going to be the same as the weeks prior. The next one goes to Radford, and you can see again where we had a spike with our students returning. That one did come down to baseline. You have to remember Radford's population is much smaller than Montgomery County, so we expect to see less cases overall. We did see a second bump, again related to some social activity with our students, but also a workplace event. And then the next curve is Floyd. Early on in Floyd, we had a couple of contained but rather substantial outbreaks, and then they've kind of come down, and they're obviously trending somewhat steady as well. And keep an eye on the y-axis. Obviously, our counties that don't have the population, the numbers on the y-axis will be less than on the Montgomery County, as obviously. Giles County, you can see, was relatively low early on, and then has bumped recently. And the next one is Pulaski County. There, same thing. We saw a little bit of a bump. Things came down, and then we've seen another rise lately. Just talking about the general trends, early on we did have our college students, but now we definitely have much more community spread. So when we look at our 0 to 17 age, Dawn, the next slide, overall, we are not seeing a significant numbers in that population, and it's fairly steady over the past several months. We do have all of our schools back in some form of hybrid learning, all 5 localities. And we are seeing very few cases in schools, and we are just not seeing measurable spread in our schools or childcare facilities. What we usually see is that they acquire it elsewhere, and then they happen to be associated with the schools. And this is a trend that's actually national. It's not just here locally. All of our schools have very good mitigation plans in place as far as masking and distancing and hygiene, and asking families to keep them home when they're ill, or if they think they've been exposed. They have very flexible plans to go back and forth between in-person and remote. And all of our localities offered an option to do virtual learning completely. So they were very flexible with our students. The one thing I'll say is we've seen more community spread. Like I said, it's not in our schools, but we find that sleepovers and birthday parties and things like that, and carpooling is where we've seen some issues. So we've really ramped up our messaging, because that's actually happening with adults as well. We tend to kind of let our guard down when we get with our core group of friends, and they might not be in our household. And so we think that, their bubble's safe and our bubble's safe. But when we mix those bubbles, sometimes we'll see some spread. If you go to the next slide, then it will show, this is a relatively stable epidemic curve for our 0 to 17. You can see it goes up and down, and but if you took a line to kind of get the average, it would be really steady. The next slide is going to talk about our college age population, which we generally we consider our 18 to 24-year-old. Late summer, when we had both universities return within a couple weeks of each other, we did see significant increases in our numbers, but those numbers came down. And since then, if you come to the next curve, Dawn, you can see that they're relatively stable. So that we had that bump, and since that time, they have not been significant contributors to the spread in the community. Our next slide goes on, and we talk about our working population, our ages 25 to 59. This is where we're seeing an upward trend in cases, and these are mostly related to social gatherings. There are families kind of mixing together, our friends, our carpooling, household spread. One thing we've noticed is that our church events tend to have a lot of spread. We are seeing some transmission in the workplace, but again, it tends to be more related to carpooling or being in our break rooms. And, we're doing really, really well when we're actually working. But then when we take those breaks, we tend to let our guard down, and we lapse a little bit. And that's where we see some of the problems. So the next slide kind of shows, we really are starting to see an upward trend as you look into October and November in our working age population. We did see a little bit of a bump in the summertime, and a lot of that was related to travel. People, I think we had the lockdown, and people were ready to kind of get out and about, and we did do some traveling. So the next slide will go on, and that talks about our older population. And that's where we're looking at our long-term care facilities. And that's one of the things that's really concerning is that we've started to see nursing home outbreaks. And it's not surprising that this kind of falls a little bit behind. There's a little bit of a delay from the increasing spread in our working population, because those are the folks that are working in our nursing facilities. Again, we have household spread, so we do see some of it if there's multi-generational families living together. Again, it's our social gatherings and our churches. You know, social gatherings don't have to be huge, but when you mix populations, when you mix people from different social bubbles, you can see that transmission. So the next slide, this shows again that we really had very little transmission early on. But then, you know, within a couple of weeks of our community transmission starting to go up, we've seen the outbreak in our older population as well. And so I think we have one more slide or a couple more slides here, just to talk about overall trends. You know, our young folks, it's pretty low and stable. Our 18 to 24-year-olds was high early on, but that has really come down. And then the shift is more towards the working age and then to our elderly. So I think this is just the entire working population for the entire district. And you can see that across our localities. And we have to remember each locality is a little bit different demographically. We have our 2 localities that have our universities. We have Pulaski has our community college, which is most of those students obviously live at home or in the community. So they have not had significant issues, but then we have some localities that have larger workplaces. And then all of our localities do have some long-term care facilities. So overall, we've just seen increasing spread throughout the district. And that's really what we've been focusing our messaging on at this point. And that's all the slides we need to show, Dawn, but that's our messaging now. I know everyone is tired. We've been doing this for a really long time. The weather's getting colder. The holidays are coming. We all feel like we need to get away. We need a break. And so we need to just really remain vigilant because COVID's not going to go away. We do have some hope with upcoming vaccine efforts and whatnot, but we really need to get everyone to try and hang in there with us with the distancing, the masking, washing your hands, and then trying to keep those social gatherings small. And remember that even if you feel like your risk is low, which for a lot of people, the risk from this is very low, you have to remember that you could intersect with somebody else in the community, whether it's an older relative of yours or whether it's a friend of yours who then works in a nursing home or works in one of our jails. And once it gets in those congregate settings, that's where we really, really need to try and prevent that.
Dr. Bissell, thank you for sharing those graphs. I think it's really powerful to see it spelled out that way, and certainly easy to see. Given what you shared, we have a lot to be thankful for heading into Thanksgiving, although you showed some of the numbers are starting to jump a little bit. But can you talk about what we've done well, what has worked? Is it much of what you just shared about the vigilance and the steps that people have taken, that our community has taken?
I think in general, our community has done well with the distancing and the masking and the washing their hands. I think, you know, we tend to get a little bit lax in those off times. So we work really hard when we're out in the stores and we're not seeing transmission in the stores. And, you know, when I go to the store, I see people keeping their distance and they're not congregating and they're wearing their mask. I think in most of our workplaces, people are really doing those things, but then we tend to forget when we get in that comfort zone. We are very social creatures, and that's a really hard habit to break. So I think we've done well, but what we're seeing in our numbers is that when we have those lapses, because we tend to be social and because we tend to want to gather, that we know how this spreads. You know, it spreads from that close social contact. And so it's really hard to kind of remind everyone, but overall, we have not seen, we have the luxury, we're a more rural area. We're not as densely populated as a lot of cities. We did have more time where we were able to prepare. And I think, you know, people did take it seriously for the most part, and it shows, you know, but we're going to see some transmission. We just have to be careful in those places where, again, where we tend to want to let our guard down because it's our close friends or it's our extended family, and we tend to let our guard down there.
You mentioned having time to prepare, and I'd like to talk about that a little bit with this group. I'm sorry, Chief Wilson, I wanted to ask you, in terms of preparing and working to really mitigate the risk and the spread of COVID, you and Dr. Bissell have led the New River COVID Task Force. Can you talk about some of the effort that that group has worked on, some of the things that you've done? It's really been a model for other communities. Talk about what you've done and why that has worked so effectively. It's been so effective.
Yeah, thanks, Dawn. And really, we kind of came together for the first time in February. And it was watching the pandemic on the West Coast starting to ease across to the East Coast. And we got a very small group together meeting at the hospital. And it was our emergency services partners and Dr. Bissell and a lot of our medical folks to say, what are we going to do? And the really good thing, and it's kind of sad that we have this in one regard, but it's fantastic in another is we have amazing relationships in the New River Valley already. We tend to take care of each other. We've had some really tough incidents here, which have kind of trained us how to come together in a time of crisis. So it was kind of an easy shift to put together a small task force. We were Montgomery County and Virginia Tech first and foremost. And what we saw was the anticipation that state and federal funding was just not going to be available, that as a community was going to face this crisis, you're going to be on your own for quite a while. And in that kind of framework, we looked at how our brother and sister counties beside us in the city of Radford and how our other major university would be impacted over in Radford. And it was quickly decided that we needed to expand this to a regional effort. And as soon as we brought in our other counties and so on and so forth, we had the logistics power and the financial power to actually get us off the ground and start drive-through testing and start some of our mitigation processes months ahead of some of our partners across the state. And I can't do this meeting, without saying, 100 times how lucky we were to have Dr. Bissell too, to set us on a course. It's easy for us to do the logistics side when you have somebody who's captaining the ship who's got you on a really steady course. So I think some of the great things we saw was the cooperation between our task force and the university, which had a ton of energy and ability that just had to be harnessed and moved in the right direction, which was an easy task for us to do. But I think that as the things progressed and we found out that this pandemic was going to be long range, it was going to be very tricky. There were going to be lots of moves and required a ton of flexibility and maintaining a fluid environment. We had the machine that was able to do it. And I think if you look at some of the positive things, and we talked about this the other day, some of the simpler things that look like on its surface, we did a high school graduation for every high school in Montgomery County on a single day in Tex Cage lot, and pulled off probably one of the coolest graduation experiences that's ever been happened out here. If they had only seen a fraction of the amount of work that went into that and the cooperation between all the entities, our folks at Tech, the parking services guy, it was just this incredible machine. But something that seemed to be so simple was so important to keeping our community going together and locked together in steps. So I think that's the way we approach things in the River Valley, and that's why this is such a great place to be. Is that we don't leave each other hanging out. And if you have something I need, it's coming. And if you have something, that comes up, I mean, our ability to mobilize and take our testing and take our flu vaccines on the road and do massive drive-through things, we can do it in a day's notice. Dr. Bissell can have us in any one of the counties. And that reactive capability has just been phenomenal. And I think every one of our citizens has seen that it's not one entity, it's not somebody, it's not one person, it's this incredible collaboration that makes it all happen. So been proud to be part of it, and look forward to, we have a lot of challenges coming. So I look forward to working with this great team we've assembled to keep going.
Thank you, Chief Wilson. Mayor Hagersmith, if I can come to you next, your priority, of course, is Blacksburg, but you've been working with other areas with this task force. Can you talk about some of the things that have gone well in terms of keeping the community safe, in terms of helping local businesses, which have really, stand a lot to lose in this. Can you talk about that? You just need to unmute.
How are we now?
There we go. Perfect.
That was just the way I practiced it, on mute. So I did it the same way twice. I appreciate you saying that about businesses, because arguably they have the most to lose of any single sector. And I have just been very proud of the way that they've stepped up, and have been glad that we could help them in so many ways. But just as a quick follow on to what the chief was saying, it may be implicit in what he said, but I'll go ahead and point it out anyway. Our Be Committed, Be Will campaign rolled out in August. And I think that has been a real strength of our response. It's born of the strong alliance that was produced early on back in March and April. But our messaging across 4 counties in the city, and with the universities, 2 universities and a community college, has been very, very consistent. And I think that's just so important. We have followed the science. We have been consistent with each other. We have been unambiguous with the messaging. And I think that's helpful for everybody. So I just want to point that out as a strength. With regard to the businesses, we have Blacksburg, there was a substantial amount of money put up front for testing, and that was wise and foresighted. But a good deal of the money, the CARES money that has come towards our town, has been put right directly back into the business community. So I wanted to just name some of those ways. Early on in November, we had small business recovery grants of up to $27,000. We had business resiliency teams, so that in the unfortunate circumstance where a business was hit with a positive case, we could quickly get them back in business with cleanup and proper messaging and all the things that they needed as supports to get back in the mainstream. We've had dining expansion grants so that they could increase their outdoor dining. We've closed down town streets. We have given parking relief, so we shut off all the parking meters. We did changes to our utility payment structure so that we gave amnesty on fees. Likewise, there was amnesty on lodging and meals taxes. We have really, really tried hard to make sure that our businesses who enrich our town in so many ways, and revenue is the least of it, so that they feel supported and that they can continue business. And I think that has been a real strength.
A lot of that ties in with students. And Dr. Shushak, I just want to ask you, when this first started, there was a lot of concern, fear even, about students coming back to the community. What have you seen? How have students actually responded?
Yeah, Dawn, that's a great question. I think just like every constituency or population or demographic, there are a portion of people who immediately got on board with public health directives and took the right kinds of approaches. With students too, there was a small proportion of students that were slow to adopt public health measures, but they got on board quickly. And I have to tell you, at this stage, I just couldn't be more proud of the way that our students have responded. This has been a terrifically difficult time to be a college student. As you can imagine, we all have a vision in our head about what college life is like and what that looks like. And our students have understood the significance of this moment. And if you've walked around the Virginia Tech campus, you will not see a student who is not following public health guidelines. It's just difficult to find someone who's not following public health guidelines. And there were times during the semester that we thought, they're gonna get tired of being vigilant here. And every time we thought that, it just didn't happen. Our students stayed committed the entire time. And I think that's why Dr. Bissell is able to share really encouraging numbers that show that COVID positive tests among the college age population has really stabilized and actually gone down from its peak early on in the semester. So we have a lot to be proud of. I think we talked a lot about Ut Prosim, our motto that I may serve. And I think people took that seriously, and they believe that doing this for the common good and protecting others. One of the things we always talk to Dr. Bissell about is whether or not she was seeing community spread from the college population to other populations. And I am so pleased that every time she said, no, we're not seeing spread from the college age population. So we have a lot to be proud of. Their students are a big part of our community, and they've stepped up and done what they needed to do. And in many ways, I think our students have modeled for others how to take this seriously and how to model public health in the name of the greater good.
Thank you. And Chief Wilson, I wanted to talk to you about along those same lines in terms of what you've seen when it comes to student behavior, and not just on campus students, but there are a number of students off campus, and not just students, but community members who are here year round, non-students. Can you talk about what you've seen in that vein?
Sure, Dawn. And I think people, that don't live in a college community often underestimate, what it's like to infuse 30,000 in this community, to infuse an additional 15,000 in Radford. And, we get this young surge of energy a couple times a year. And it really does take a lot of logistics to pull it off. There was tons of anxiety. Our community members were loud and vocal. There was fear that was transparent. I mean, it was something that we knew was going to happen, but I think we even were shocked a little bit about the level of anxiety about the students coming back. And we were very lucky to have the epidemiologist, that Dr. Bissell has, that can kind of explain to us what to expect. So from our emergency services perspective, we had a much better vantage point to see what we thought was going to happen, and it really did play out. I'm like Frank. I can't be prouder of our students here. They did come back, and it was, people forgot that they hadn't seen each other since spring break the last semester. And really, I think a lot of them had it in their mind that the pandemic would not really affect their college career. That they come back, the weather's beautiful, they haven't seen their friends, and we had a few pushes on our behavior charts. But I was shocked at how well they acclimated to this, and they dropped into small groups, into pods as we speak, and how cooperative they were. And this is not a great time for law enforcement in this country either. But our students were some of the most polite. When we were out there, we were doing a ton of just simple mentoring folks about how to navigate this kind of tough water. And I said we had football games, sort of. And those weekends, I couldn't have been prouder of how the students did it. They did exactly how we asked them. And I spent a lot of nights Zoom calling with a lot of student groups just to see how they're doing. And I think they're a model for a lot of our citizens that how well you can do following the rules and so on. And I sent Frank a note one day. It was probably the proudest day I was of being a Virginia Tech graduate, was simply going to Kroger's in the middle of the week and watching the dynamic. It was full of students, full of local consumers and so on. And they were everyone was masked. And I was shocked at how polite they were about distancing and being courteous to one another. And I thought, that's really kind of puts our community in a perfect perspective. And that's what we are. It's one solid community. Our students are just as much citizens as anyone else. And they've acted just as well as we could have asked them to do. So couldn't be prouder of our Hokies.
Next, I just want to ask each of you to elaborate on this question. And it's about what you've learned as a leader of this community. I know, Chief Wilson, you talked about us being in situations before where we've had to come together, but I'm just wondering if there are other things that you might touch on that you've learned through all of this, from working together, not just the good things, but things that you may have learned that we could potentially do better as I think I froze.
We can hear you now.
There we go. Sorry about that. Did you hear the question? Should I repeat the question again? I don't know when I froze. I'll just ask it again.
Yeah, go ahead.
I just wanted to ask each of you to elaborate on this question, and that is what you've seen, what you may have learned through all of this about our community, whether that was something that worked really well or perhaps something that we could do better as we move forward. I think I'm frozen again.
But we can hear your voice.
Stop my video for a second, and maybe that will help. Can you guys hear me? Technology. I guess 6:30 is not a good time to do this. I'm going to try this a third time. Third time will be a charm. Just wanted to know what you may have learned, and each of you, if you can address this, what you may have learned about our community as leaders in this community, and not just about the pandemic, but in terms of working together, what we've done well, what you may have learned that we could do better moving forward. Dr. Bissell, would you like to start, or anyone can take it? I just wanted all of you to answer.
So I think from my perspective, our community is very diverse, and we have lots of differences of opinion. And during a pandemic, there were a lot of challenges with social media and the media. It was an election year, the political divisiveness. The other thing is understanding that we're learning about this as we go. So everyone talks about the science and whatnot. The science literally changed as we go. And, we see things that come out at local levels, at national levels, internationally, about what experiences have been. And then, we're following it from a local level, our local epidemiology. So, it's really what we found is trying to be about that calm, steady presence, because we have people who really are very fearful of the pandemic. And we have people, on the other hand, who are somewhat dismissive of it. So we're trying to find that calm, steady balance and bring everybody together, that no matter where you stand on that front, yes, acknowledge that most people will actually do very well with this. However, there are people who will get really sick and will die from this. And I think our messaging campaign, I think the Be Committed, Be Well campaign, I think having the videos go out, I think putting out the updates really helped kind of bring everyone more to that middle ground. We definitely still have some people on those extremes who are looking at absolutes, but by and large, I think most people are finding that middle ground, and they're realizing that the masking and the distancing, those things really do work. So, I think that was the biggest thing, is remembering that people come from different perspectives. They are on two extremes in a lot of ways, and trying to bring them together. And our community did. This is a little bit different than some of the other tragedies that we faced both nationally and locally. But I'm pretty pleased where we are right now. And like Chief Wilson, when I go in the stores and I see even the littlest of kids wearing their mask, and Someone made me Chief Wilson's wife works at New River Community College, and they 3D printed a COVID, and I have it hanging from the rearview mirror of my car. And there was a young child, she couldn't have been more than 6 or 7, and she walked by and pointed out to her dad, "Look, Daddy, that's a COVID." So, I think we've come together. And despite those differences, I think we really have.
Mayor Hager-Smith, I'd like to ask you next. What lessons have been learned?
Well, last time we had a chance to be together on a Zoom call like this that was broadcast, I remember saying that Blacksburg is not every other town and Virginia Tech is not every other universe. And I said it at that time, hoping that it would prove true. And I think it has. So that is lovely that it has borne out in the ways that the previous speakers have talked about. And also, I have relearned how resilient our businesses can be and how important they are to us. This may sound critical, and it's not, but it is pretty astonishing to think that as difficult as life has been for the last 6 months, other localities have not much been touched. Tax revenue in Montgomery County, for example, is actually up. And that's not the experience that Blacksburg's having at all. We really are hurting. We hurt when our businesses do, but they are doing every strong and nimble and creative thing. Some of them have gone to more online ordering. They've changed up their websites. We've got the Blacksburg Delivers program. I'd like to talk to you later about our new Blacksburg Bucks program that the town is doing in partnership with businesses. But they are just so important to us. And if we can get through this together, we're going to like the way it looks at the end a lot better than if all we have to choose from is Amazon and other online traders.
Awesome. And we'll get to looking ahead too and what that looks like. But for now, Dr. Shushak, would you like to share some of the things you've learned?
Yeah, sure, Dawn. I mean, I think some of the things that strike me are the things that have been lifted up here is that we really are able to accomplish a lot when we work together, and that we understand the different tensions that different elements of our community feel at different times. So the mayor talked about that this is particularly challenging for our businesses, and understanding that and empathizing with that and understanding how we can respond in a way to help our business community members to understand what our students are up against, and to try to empathize with our students, to understand what our staff are trying to do and what that might be like, and to empathize. The good news at the end of this, I think we have seen very clearly what that kind of working together can do. So as we think forward, I think, how do we post-pandemic embrace that same spirit, even when we're not in a crisis? Which I think Blacksburg and Virginia Tech have long been known for. But what's clear, that to the extent that you do it, is the extent to which you're able to be successful for the greatest number of people. And I think that's what we want to be about here. We want to be about the common good. We want to be about everyone's flourishing, everyone's thriving. And when we do that together and communicate, even when we have differences, and when we're able to talk through our differences and share our differences, that helps us be more resilient. I love that we can talk candidly with each other about what our own tensions are, so that other perspectives can understand where we're coming from. And I think we've done a lot of that, but it hasn't hampered relationship. It hasn't hampered community, and it hasn't hampered the well-being of our community. And those are all really good things to hang on to.
Thank you. Chief Wilson, would you like to add anything?
Yeah, and just to finish up, I think most of the points have been touched on. Probably the biggest lesson to learn that we did is we've never done such a long duration event that moves so slowly when information moves so quickly. And we saw that misinformation seemed to even move faster than the real information. And it was, you had to quickly, and I think as we learn lessons for the future is how fast we need to be able to communicate the right information, how much we have to be able to move fluidly left or right. But I think, ultimately, the lesson that's going to come out of this thing is the communities that were able to pull together. And to Frank's point, that there have been a lot of decisions. There's been a lot of things that have caught us off guard, that have been made, because necessity said they had to be done right away, that could have shattered relationships, that have been long held. And I think that really showed our true colors here. And those are the kind of things that I see that we'll have to strengthen in the future, and have them in our toolbox ready to pull out for the next thing. But I really do applaud the fact that we have maintained this communication with each other, and we've kind of kept this community spirit going, even as we ask people to kind of segregate from one another.
And let's talk about moving forward and what we need to do. Dr. Bissell, you spoke earlier about continued vigilance and maintaining that vigilance. But I guess twofold is my question to you, Dr. Bissell. One, what do we tell people as we're heading into Thanksgiving? A time obviously when people traditionally get together and gather. What do we tell folks wanting to still celebrate Thanksgiving? And also beyond Thanksgiving, what do we need to do to get where we want to be in a few months?
So I think a couple of things. Obviously, with numbers going up, there's a lot. The CDC, our governor, have come out and said, you have to really be careful about your gatherings. Again, we know that this is spread through close social contacts when people from different households gather. So obviously, our college students are heading home, and we ask them to be really vigilant in the 2 weeks before they headed home with their behavior, because it really is a behavioral thing. And we offered testing before they went home. Those of us who are gathering locally, obviously, it's the same thing. The outdoors is safest, and staying within your household. If you are going to kind of combine households, you want to keep it small. You want to be outside if you can. You want to mask indoors if you're bringing multiple households together. We've learned that masking really works. It works as that source control, and it works as that inoculum control. So it really prevents the spread in a lot of cases. We want to take the focus away from the meal, because that would obviously be when you take your mask off. And if you are going to have the meal, obviously outside, or really separating in the house, having the windows down, ventilating. So it's a little bit different, but you can still do that connecting. And we want to connect socially. That's why we prefer to say physically distant. When I hear socially distance, I want to talk about physically distance, because it's really important that the side effects that we've seen from not, from separating and from keeping that distance are the mental health and the anxiety and the stress and those things. So we really do want to stay socially connected and physically distanced. And we can do that. We have to be creative. We have to be smart. The other thing is technology. Everything all of a sudden went to Zoom. And hopefully we'll get back to where not everything is Zoom again, but it is a good platform, these kinds of things, FaceTime and Zoom and WebEx, or the telephone, just to pick up and connect. And so, this really has stressed that we need to stay connected. We need that support structure. We're coming into flu season. It's getting colder. People tend to be inside more. People are tired, and the holidays are coming, and we can still have that joy, and we can still have that togetherness. We just have to modify, and it's hard to change, and we are social creatures. It really is hard to change, but people are showing that they can adapt, and we can look forward to next year that the weather improve again. We have some very promising vaccine trials that we'll be able to get back to, normal. Although I would hope that some of the things we've taken here that we can continue, because it will help with communicable diseases of all kinds, including the flu. For instance, staying home when you're sick. A lot of people tend to want to just push through or power through, and we really need to focus on, that's not a good thing, because we have to look out for our community members. And we have to think about the consequences that we could spread it to someone. What for us might not be a big deal could be a very big deal to someone else. Washing our hands. We had really good public health data that people were not washing their hands nearly enough. So hopefully this is we got away with it. We got very complacent. So hopefully this is kind of teaching us that, this is a really good behavior and practice. And even masking. I know people want to get rid of masking. When can we go without masks again? And I would hope that it's not that absolute all or none, and that during flu season, if we're having a bad flu season, we pull those masks out again. If we're having outbreaks of a respiratory nature, it really can be a preventive mechanism. And we have to remember that there are all these communicable diseases that, again, a lot of people will do just fine, but you never know who won't do just fine. So those are things that we can do to protect ourselves, to protect our family and our community.
Thank you. And Dr. Shuchak, I want to ask you, as students, we know starting Friday, students will be leaving for this semester, for the remainder of the semester, I should say. What advice do you have? What are the recommendations for students as they head back into their, this is home, but their former homes,
Yeah.
their families?
Yeah, that's a great question. And I think that the good news is our students know what good decisions look like. And so what they really need to do is just keep making those good decisions. The other thing I would add that as I would encourage our students as they go back into environments, that maybe the accountability and the homogeneity of adherence to public health guidelines has not been as consistent, that they become an opinion leader with their families, with the people in their town, and encourage them to stay the course and to stay positive. The other thing, and it's not directly related, is I hope our students take Thanksgiving to take care of themselves, to maybe lay off the technology for a little bit, to get rest, to go for some walks, and to find perspective. This has been a hard season, and I'm not telling anyone anything they don't know, but if you can think of a couple things that you can do for yourself to take care of yourself, and because that's going to give you the stamina to keep going. So keeping that stamina, so that when you come back after the holidays, that you're ready to push through this so that we can get to the end and be successful.
Chief Wilson, I wanted to ask you a couple of things. The Centers for Disease Control announced today, or made the recommendation today, for people not to travel for Thanksgiving. And the governor earlier this week increased restrictions, rolled us back a bit. Can you talk about how our community can not just help with that? We've talked a lot about that tonight, the steps that we need to continue taking as a community, but what your department's role will be, even in terms of enforcing that and enforcing those restrictions.
Well, unfortunately, I think we're all a little restriction tired at this point. And I can look at this panel and see that each one of us has been part of some very strong messaging to our community about their behavior. But here again, and we see as much pushback from a governor's restriction or a federal mandate, or CDC puts out something today and then changes their mind tomorrow. That was part of the reason our task force put together this robust communication piece. And I think, when we got together and brought in our public information officers from all of our localities and our university, it was because the answer to this pandemic was not going to be in a strict and in a strong enforcement policy, because I'll be honest with you, the guidelines that come out, they come out with such broad scope. They're very difficult to pin down any enforcement strategy, but they are wrought with things that need to be explained. And that's what we've done very well from the beginning. And you'll see that our communication strategy will start to move, as the restrictions come out. We spent a lot more time not simply echoing the restriction, but explaining the restriction and explaining how to best suit it. And then to the mayor's point, we did that with our business community. We went way out in front with our restaurant folks to say, this is coming, and let's adapt. Let's figure out how to do this as a community. And by doing that, I think we get a whole lot more community buy-in. And it's less about who's gonna crack someone with a stick and who's gonna bring the carrot. I think so. Like I said, we see this as this is continued to be a community fight, and we're gonna try to message folks to explain why we're in this situation, why the conditions have changed, and help mentor them through these kind of tough times. I think people are tired of being dictated to, just black and white restrictions and so on and so forth. I think they really appreciate the fact that we come together as a community and put Dr. Bissell and some of the experts directly in front of them to say, this is the why we need to slow down, or this is why we have to change course a little bit. So like I said, the community, just like I said, when you see us messaging you, when you see things coming out of the task force or coming out of the university, it's been well vetted. And really, if you look deeper, you'll see the explanation for why we're moving north, south, left, right, in any direction. So I think that's kind of the key point.
And Mayor Hagersmith, I wanted to talk with you again about our local businesses. Local businesses really made a lot of changes to shift to be able to function in this environment. And I guess I wanted you to, talk about that, and also talk about a new effort that was announced just yesterday or the day before, Blacksburg Bucks, to really help local businesses, especially as we head into the holidays.
Yeah, they really have stepped up, and this is something we want to do to give back, especially for the holidays. So the town of Blacksburg is prepared to put up $100,000 in matching funds. And this is an initiative that actually begins tomorrow. So there are 6 locations of the National Bank of Blacksburg where you can buy Blacksburg Bucks starting tomorrow at opening hour. And any amount that you buy, it will be matched 100%. So if you buy $100 worth of Blacksburg Bucks, you'll get $200 in spending power. And there is a list on the town's website of the participating vendors. And it's not just retail, although that's a great place to spend your money. It's dog groomers and dentists and all kinds of businesses have come together to participate in this program. The great thing is that it's hyper local. So all the money that you spend will go directly back into our town. It will benefit people who are drawing up their Christmas and holiday gift lists. And you have 6 months to spend these bucks. And so it doesn't have to be spent between now and Christmas, say. You have 6 months to spend it, but it will go, it's a direct infusion back into the community.
I checked out that list earlier today, and it is robust. There's a lot on there. There's a lot of opportunity there. Anyway, thank you for sharing that. I do want to talk about spring as well. We talked about how we would look forward a bit. How do we use our time before then to make sure that we get there the way we want to be and what we want that to look like? And what do we want that to look like beyond the not having a pandemic, obviously? Dr. Bissell, would you like to start us off and talk a little bit about what it might take in the next few months to get back to some sense of normalcy in the spring, aside from some of the things you talked about washing hands and the steps that we could take. I know you touched on the vaccine. Any information about that would be helpful as well.
Yeah, so I think it's really important, and kind of to what Chief Wilson was saying, let's talk about what we can do. You know, the restrictions are all about what you can't do, but there's a lot of things that we can do. And let's support each other. And, you know, that's one of the things that the task force and the town and everybody has done, you know, trying to support our most vulnerable folks, and continuing to do that, because in that spirit, it gives us a sense of fulfillment too. And that's a way to keep people going during this. And Dr. Shushak's right. Find ways, take advantage of being outside, take advantage of, you know, the local landscape, and find those ways to kind of regroup and recharge your battery to keep going. And again, you know, it's about being positive, moving forward and looking towards spring, right? That's always a real positive thing, because the weather's going to change and we'll be able to do outside things again. The trees, the landscape, things will really look much more promising. And then, yeah, the vaccine is pretty exciting. I mean, I have to say, you know, we have two companies that have come out with some pretty encouraging news about vaccines, that they're very effective. We have some good stuff coming out, that immunity is a little bit longer lasting than we were thinking. Like I said, we're learning as we go with this, but the idea that we could be looking at a vaccine as early as the new year is really exciting. Now, we can't count on that to be the end all be all, because it will be phased in. It'll start with our healthcare workers and our first responders, and then we'll look at, you know, some of our congregate settings and our higher risk populations and rolling it out. But it does look like by, you know, springtime, April timeframe, we could have a vaccine that we could roll out with our community. A lot of what we're going to be doing is trying to get out why the vaccine is so important. That this can really help with the spread, and it can really help us get back to that normal. But again, you know, I'm hoping that some of the stuff we're doing now, we can keep. Some of those practices we can keep, because it'll help us with all the other communicable diseases, and it'll help us if there is, or when there is, another pandemic with global travel. I think we have to be prepared that these things will happen. And so we'll be better prepared to deal with it. So that's really encouraging, that yes, there's something to look forward to. There's the light at the end of the tunnel there. You know, science has moved really fast with this. I mean, when you look back, and I think that's another thing to be really encouraged by, and we have to message that really well, because I think in some ways that brings about some doubt. When you look back in the 80s and 90s, when we first had HIV, it took us years to even identify HIV. And this virus we identified within a week. And I know everybody knows that the normal vaccine process is much more drawn out than just months. But they are overseeing it. They are enrolling the people in the trials. They are doing all of the safety and the efficacy data. So yes, it has happened, and it's probably cut out some of the bureaucratic stuff and the regulatory stuff that hampers things. Obviously, there was the expediency for that, but the data that they're putting out there, that's the data from the scientists, from the people that they are totally into this. Just like if you look at Fralin, right? You know, there are people, Carla Finkelstein at Fralin and Mike Friedlander and that crew, they turned on a dime because they are into this for their community. And they created this test, and they work long hours and really got this test up and running for us. So we have to trust that there are people out there who want this for our community. And that's where we're going with it. So I think there's a lot to look forward to. I think there's a lot of positive stuff. There's the light at the end of the tunnel. There's the spring, and we need to stay focused on that. And as Dr. Shushak said, we need to really focus on ways to take a break, to recharge, for that you know, it's a marathon, right? It's not a sprint.
Dr. Shushak, we hear a lot of students talking about wanting that in-person experience and wanting to be back, and our community certainly wants them back. Can you talk a little bit about whether that's possible and what we can do to make that happen?
Sure. A theme of our conversation today has been we've learned a lot. It's hard to believe that we started all this just in March and how far we've come and what we know about the virus and how it works and how to protect ourselves from transmitting the virus or receiving the virus. And the good news is that combined with students who have been willing to make really good decisions are allowing us to understand how we can hit a balance from a public health standpoint from different perspectives. One of them is this emotional health of our community, plus the virus. Those are both public health issues that we have to think about. All that to say, we're in a place where we can, I use the metaphor of a dimmer switch. You know, in March, we didn't know a whole lot. We shut the lights off. And now we've been pushing the lights up a little more and a little more. And I think the spring, when we come back in January, students are going to see some things going to feel like, there's a little more light here at Virginia Tech. And example of that is we're launching a pod program where you can register your residence hall pod of up to 15 people so that you can operate a little differently when you're in your 15-person pod. And because we've incorporated testing, prevalence testing, and we know who your pod is, we can manage those things better. So that's a really piece of good news for our residence hall students, that they're going to be able to engage a little differently. We're also going to be increasing the number of intramural sports and in-person programming, again, using all the science that we know about how we protect people, but we think we can do that plus increase in-person experiences. So I think our students are going to see, hey, it's a little brighter the spring semester, and that's going to be good news. And it might be even a little more bearable because of what Dr. Bissell said, is you see spring metaphorically coming. We're still in winter, but spring is coming, and you can see signs of it coming. And I think that's literally and figuratively, and that's going to be good news.
Mayor Hager-Smith, earlier this week, you and I spoke when I was asking you if you would take part in this panel discussion, and you said something really interesting, and I wanted you to talk about it here with the group. When I said that I just wanted to talk about what you each would want to see long-term for our community, you talked about sort of bridging that divide that has happened a little bit in our community. And I just want you to talk about that and share a little bit about that, and in terms of how we work through that and what that is and what you are looking forward to seeing come back together.
Yeah, this probably seems a little disjointed from what we've talked about so far in the past hour, because there has been so much partnership, such a strong response together. But it does occur to me, as we have a moment to pause and catch our breaths here, there's a kind of bittersweet paradox, because through most of the last several months, we have counted our success by the fact that there wasn't community spread, that the students were by and large well, that they were coping with the virus well, but they were keeping it to themselves. And this was, I can tell you, this was a satisfaction to a lot of our residents. That felt good to them. But at the end of the day, what are we left with? The legacy of the virus will be really, really helpful to government leaders, elected officials, our professional staffs. I think businesses are going to come out stronger in many ways. But at the end of the day, we were successful to an extent because the students were sequestered, and because the townspeople stayed to themselves. And the Blacksburg that I moved to years ago and learned to love wasn't like that at all. And I think where we will want to get eventually is in a healthier place where the townsfolk mingle with their faculty members and mingle with the students, and we are all more together. And I'm thinking about, hiking programs and civic dinners and art and performances and sports and festivals, all ages, all circumstances. This has always been a strength of Blacksburg, high engagement and openness. And we may need to be very intentional. We may need to exercise those muscles. They may have become a little atrophied while we've been working on COVID.
Thank you. I appreciate that. I guess, we have about 25 minutes left, but we can certainly give people their time back, but I didn't want to let us all go without giving you an opportunity to just share some final thoughts or share something if I didn't ask something that perhaps I should have. Chief Wilson, would you like to start us off?
Yeah, I think that one of the coolest parts of as this semester winds down, and I'm going to give a shout out to our public health students from Virginia Tech, our COVID crushers, and now our COVID companions. And these were student-driven ideas, student-driven groups that wanted to come off the bench and get in the pandemic, get in the game, and figure out how they could help. And I think, we had a meeting today, and it was amazing to watch them thinking. They're already thinking about what to do over break, how to expand this program, how do we get more involved. And that's the refreshing part. I think part of the thing that, we looked at is we were trying to figure out how to navigate and how to restrict and how to keep this disease from overtaking us. We did lose a lot of what the mayor talks about. We lost a lot of that connection. And as we've gotten better at this navigation, we're kind of learning that we need to reinvest our most, valuable currency, and that's our community currency. So we looked at it. There's things coming up. I want everyone to go home and take a break, a well-deserved rest, get healthy, stay healthy. And when you come back, be ready to work. I mean, there's going to be a lot to do. We're going to be in winter, and I think that the spring will come, but we're going to have some things we're going to have to get done. And I really think that this will be the semester that we really engage our students in community endeavor. We've got people to feed. We've got people to take care of. The pandemic won't be gone when they come back. It'll still be here. It'll still be part of our life. But I think we have a really huge opportunity to engage them in some of the best work they'll ever do in their life right here during this college experience. And it'll put them on the right course for a really successful spring semester. So anyway, I really wanted to, I think that seeing those groups that have come off the sidelines and jumped in the middle of this pandemic gives us a ton of hope for the future. We have a great student body. We have great young people coming up, and I can't wait really for them to get back. I know they haven't left yet, but and that's, people say that's probably odd. The police chief can't wait till they get back, but I really can't. I can't wait till we get them. I think we were talking about, instead of doing the big event, it's like the weekly event, to get us through spring and get our students, faculty, and our citizens together working on community projects starting this spring and taking care of everybody in this big community. So I look forward to it. It's been a rough fall sometimes, but it's been a very successful fall. And I look forward to even more successful spring.
Thank you. Dr. Shushak?
Oh, I just two quick things. One is what I'm telling myself is to be gentle with people. It's been hard out there, and to notice people who might be struggling, and to lean into how we can help people who might be on the margins, because it's been a tough season for so many people. But then the second thing is, I just want to say a big thank you to all of you. I admire you all greatly, and it's been fun watching you work and to, to live into your craft and into your calling, and to see it come together in such a monumental way. And so just I want to say thank you. It's been terrific to work with you all, and I appreciate all that you've done for our community. And I look forward to being on the other side of this.
Thank you. Mayor Hager-Smith?
I think I would like to end by giving a special voice to my appreciation for Chief Wilson and the police department. He mentioned something just in passing early in this conversation, but that was that this summer began in Blacksburg with 5 rallies critical of the police, and yet they were all supervised and escorted by our police department, and every one of them remained peaceful. And this is against a national backdrop of a lot of tension to do with policing in our cities and in our streets. And so this has been for the chief. I don't speak for him in this case, but I have to believe that for our men and women in uniform, this has been just one of the most difficult challenges. Our well-being has been so tied to the incident command structure that Chief Wilson and his department put in place, at the same time that they have been subject to so much scrutiny, continuing in, bubbling under the surface here in town. And I just want to say, I don't know how you do it, but I'm glad you did.
Thank you. Dr. Bissell?
Yeah, I would say that this is a pandemic, and people tend to want to say there's nothing good that can come out of it. Obviously, it has its challenges, but and the inclination is to look for all the negative, and certainly our media and our social media tend to do that. But I want to challenge everyone to find the positive, and there is positive that's come out of it. We can't just make it go away, but we can find really positive things, and that community spirit. The COVID crushers and that group of public health students is phenomenal. Our Medical Reserve Corps, there's no way that we could have done what we've done, or looking forward, vaccination effort. It's going to take. The Medical Reserve Corps has signed up hundreds of new volunteers, and they've been out there every single day, rain or shine or freezing cold, helping us with our testing and with our flu pods and everything. So I think I want to challenge everyone, as Dr. Shushak said, be kind and find that grace. But then I do want to challenge everyone to try and to be on that positive side. And instead of that natural inclination, think about all the reasons that this really is a horrible time, to think about how we're responding to it, and how we can give back in a positive way. And just how our behavior and what we say and what we do can actually change what others are doing and what others are saying. And it really can kind of snowball and just change the way things are. Pandemics are definitely global events, but one of the things we're putting out there is that they're experienced locally. And so our community has a tremendous effect on how we experience it locally.
It's really good advice. Thank you, Dr. Bissell. Before I send things back to Steve to close us out tonight, I just wanted to say thank you all for your insight and for sharing with us. It's really important conversations to have, and I'm thankful that you all could be a part of it. So, thank you, and Steve, we'll send things back to you.
Sure. Thank you, Don. Again, I want to thank everybody on this panel for participating tonight. You all have done such a wonderful job throughout this pandemic, each of you with the roles that you've played in leading the community. And 2 words that stood out to me through the whole conversation were the word community and pride or proud. Chief Wilson, I've had this conversation many times. This community's been through so much, in the 14 years I've lived here, and I'm sure the 30 years that he's been here, as well as the mayor. And this is just another example of Blacksburg pulling together, the region pulling together to take on a really monumental task and come through it really well to this point, and with a lot to be proud of. So again, thank you to each of you for participating tonight. Hope everybody takes some time, as been mentioned several times, to kind of recharge batteries and get a little rest. And if you're traveling, to be careful and be safe, but spend some good quality time with your families. Enjoy these holidays, and come back ready for a great new year. Whether you're a student with new semester or in the community, just having that energy that's going to come back like it does every year. Comes back in August and comes back in January. A lot of energy. So let's all be prepared and ready for a great spring. Hoping that things will continue to progress in a positive way, in how we're addressing the pandemic, with the way science is progressing, and with vaccines and getting those out into the community. So I just want to remind people also, that we do have Town Gown in February will be our first meeting. We'll have a meeting in February, March, and April. Hopefully we'll have some fun topics. We've tried to keep things pretty light this year. And just again, thanking again the panel, and wishing everybody that's watching this evening, a great holiday season, and we'll see you next year. Thank you.